Hello everyone. So sometimes patient is having reduced LV systolic function. LVEF is low, say for 15 to 20% or 25%. Severe LV dysfunction is there. So a question arises: should this patient be given IV fluids? So if there are definite evidence of the dehydration or volume loss, such as patient with severe LV dysfunction having decay leading to severe dehydration associated with the sepsis or septic shock, any form of shock. So even if the patient is having low LV ejection fraction, he requires some preload to maintain his cardiac output. So cardiac output, it is majority determined by the preload and afterload. So they also need the fluids to maintain the blood pressure. If you fail to give the fluids and just keep on adding vasopressors like noradrenaline in the empty vessels, these patients, they are not going to improve. So simply having a low ejection fraction does not necessarily mean you should not give IV fluids. Whenever there is need, after the initial fluid resuscitation, if the patient is in shock, of course, initial administration also, it should be judicious, which should be monitored by the available clinical as well as the objective parameters, so as to avoid the fluid overload. And after the initial resuscitation, whether to further continue the maintenance fluid, that should be judged by the advanced hemodynamic parameters. But if you fail to do the initial resuscitation with IV fluids in such patients, such as low ejection fraction with severe dehydration, such as due to decay, acute gastroenteritis, or if any major bleeding leading to hypovolemia, so we must administer IV fluid in this patient. But we should be very prompt, and we should be very watchful in such patients. So and we should be knowing where to stop so as to avoid the fluid overload. Thank you.